Thank you, Mr. President. Yogi Berra once said, it's like deja vu all over again. Here we are, feeling the echoes of the recent debates over health care. Yet another Republican plan to dismantle health care, the peace of mind of millions of Americans, coming to the floor. Well, we've seen the previous plans. We've seen the House bill that was going to wipe out health care for 24 million people. We saw the bill that came over from the Senate in June, wipe out health care for 22 million people. And then we saw the Republicans' improved version of that, wiping out health care for 32 million people. And now, July of this year, yet another plan, back to 22 million. Millions and millions of people losing their health care. And now we have one more last-ditch effort to destroy health care for ordinary Americans, for rural Americans, for working Americans. It's just wrong, and I'm going to explain some of the reasons that all of us should be outraged by this bill. This new bill which says immediately the individual mandate and the company mandate are wiped out. What does that do? That means instantly in 2018 and 2019, it's a destructive race to the bottom for the insurance pools. If there's no pool, if there's no mandate, then only those who are sicker sign up. And those who are sicker are more expensive. So then more people drop out of the healthcare pool. And the pool becomes even more expensive. It just shoots right out of sight. So we're not talking just about damage that would be done in 2020. We're talking about damage that would be done next year and the year after. What happens when the insurance companies say there's only 2 years left on this and the healthcare pool has a big hole in it? The healthy people are gushing out and only the sickest people remain? They're going to drop out of providing coverage. So suddenly we have hundreds of counties across the nation with no health care provision for those that are currently in the health care marketplace. We've been through this conversation. We've been through the Ted Cruz fake insurance bill, and it was voted down by this body with a substantial bipartisan majority. This is a repeat of that, saying let's destroy those insurance pools. What else does this bill destroy? Well, in 2020, it destroys the tax credits. So let's say you were fortunate enough to have the pool survive 2018 and 2019, and you have tax credits to enable you to buy insurance, and there's still a provider during those 2 years, but then comes 2020, and there's no tax credits with which to buy insurance. So now you are thrown out of health care. No remedy provided in this bill. And is it possible that you're going to get covered by the Medicaid program in your state? Well, not likely, because Medicaid in most states provides insurance for poorer Americans, not for the folks who are getting the tax credits in exchange. No, they are out of luck. And what else do we have? The elimination of essential benefits. Essential benefits no longer required. Now we have some history with this here in our country. We've had those fake insurance policies that you buy that cost virtually nothing, and then you get sick and discovered that your trip to the emergency room isn't covered. You discover your hospitalization is not covered. Then your child gets injured and they break a bone. You discover the x-rays are not covered and the lab tests are not covered. Oh, these are the fake insurance policies that don't belong anywhere because they are simply a fraud. This is the scam. Why are we returning to a vote on fake insurance? Not only do we lose the individual mandate and the company mandate that makes sure an insurance pool is the pool having both sick and healthy people so that insurance companies can actually provide insurance, but we also have this provision of this fake insurance where you have a policy that costs virtually nothing, and then covers nothing. So it's sold to those who are vulnerable to the sales pitch of the scam man. And what else does this do? Well, right now, we have this very complicated healthcare system. It's a big improvement over what we had 8 years ago, but it's still complicated. We have Medicaid, and we have Medicare. We have on-exchange. We have off-exchange. We have special insurance for the workplace called workers' compensation. We have special insurance for children called Children's Health Insurance Program. We have workplace policies that are very good benefits covered by the company, and we have workplace policies that are very poor policies. We have workplace policies that are paid for by the company and those that the individual has to buy into the workplace policy. Then we have policies that cover just the worker and ones that cover the family. What do you do as you navigate this incredibly complex array? This is a continuous, stressful journey for Americans. Maybe you have a job that doesn't pay very much and you're able to be on the Oregon Health Plan or similar Medicaid programs across the country. And then you earn a little bit more, or your spouse earns a little bit more. Suddenly you don't qualify. How do you get onto the exchange in the middle of a year? How do you work out those tax credits for the end of the year? Or maybe your next job provides some insurance for you, not your children. How do you get your children signed up? Very, very stressful situation of this complicated, overlapping healthcare that requires continuous attention just for people to make sure that if their loved one is sick, if their child is injured, that they will get the care they need when that happens, and that the family won't end up bankrupt. It's a pursuit of peace of mind. What does this bill do? It makes our already complicated system even more complicated. It says in this bill, we want to have 50 different systems for 50 different states. So much for focusing on a simpler system where we can work to drive out any fraud or inefficiencies or abuse. No, now we have 50 systems pursuing different forms of fraud and waste and abuse. Now, we should be going in the other direction, towards simplicity, towards a world in which just by virtue of being an American, you know you're covered. You don't have to worry about that transition from job to job, or that change as you go from one income to another income, or the dynamics that occur should you get married or get divorced. No, just by virtue of being American, you're covered. That's the way the whole developed world does it. They make it easy, except here. We make it complicated. And this bill is determined to make it much more complicated, much more fractured, much more stressful. So let's not do that. Let's apply a little common sense and recognize none of us would run a business determined to make the workplace more stressful, more fractured, less efficient, more filled with fraud, but that is what this bill does. So let's say no. Let's have a huge bipartisan response to say absolutely not. Now it's grassroots America that defeated those previous diabolical plans to wipe out health care for millions of Americans. They filled the streets. Grassroots America overflowed our inboxes. They flooded our phones. And once again, we need the common sense of working America, of grassroots America, to weigh in and say how wrong this proposed bill is. During the debate previously, I kept noting that this was like a monster that you can only put away by driving a stake through its heart. And each time we attempted to have that debate on the floor and we defeated the bill, I thought, well, perhaps we finally put this monster 6 feet under. But now it's back, in all its ruthless tooth and fang fury, ready to destroy peace of mind and health care for our citizens. So let's take a vote in this Senate that will do what we hoped we had done before and truly drive a stake through the heart of this Trump care proposition. Let's stand up in partnership with our citizens. Oh, I know this room is full of really wealthy Americans who have never worried about health care. When I was first campaigning for the U.S. Senate, I met with one of those really wealthy Americans in New York City. He said to me, I don't know why you're saying you're fighting for better health care. Everybody in America has good health care. Well, that's because that individual lived in a bubble where he was surrounded by everyone he knew having good health care because they worked for really wealthy firms in New York City. They are so dramatically disconnected from the reality of working Americans. I'll tell you what's going on in my neighborhood, my blue-collar neighborhood, the same neighborhood that I went to for grades 3 through 12, the same neighborhood my children went to. It's getting tougher, not easier. It's getting tougher to find a full-time job. It's getting tougher to find a living wage job. It's getting tougher to be able to save to help your child pursue their dreams. It's tougher to be able to help your family perhaps go on a vacation, even a simple vacation. And it's certainly tougher to buy a home. In fact, many people in my neighborhood feel the only way they're going to be able to buy a home is to inherit it from their parents. But I'll tell you, there's one thing that got easier in the last 8 years against all of that. One thing. And that was that we provided expansion of Medicaid to cover a lot more people, and we created a marketplace for insurance where working people could use tax credits to be able to buy care, could easily compare policies. So we made a big step forward in one single area, one area. And now my colleagues from their gated communities and their 7-digit wealth want to come and destroy the one thing that we did for working American. If President Trump cared one whit about a working American, he'd be ringing up the majority leader of this chamber right now and saying, what are you doing? I campaigned saying I was going to stand with workers. This bill attacks them. What are you doing? He'd be calling up and saying, I called that House bill mean. That House bill, which eliminated health care for 23 million Americans, the final bill, said I called it mean and heartless. This is meaner. This is even more heartless. But we shouldn't need the insights of President Trump to be able to understand the damage that this does to ordinary Americans. You can see it plain as day right there on the pages of this bill. So colleagues, read the bill, talk to your health care experts, and drive a stake through this health care monster. Thank you, Mr. President.